I want to discuss the urinary system, and currently we're going to begin with the kidney. I'm going to use this small kidney model first, and I'll look at all the kidney models that we use in this lab, especially those who show all the major parts. And on this kidney model, we can already see on the outside of the kidney the capsule, or the renal capsule that surrounds it. Remind ourselves that kidneys are made of reticular connective tissue, and on the outside here you can see the renal capsule. Now the rest of the portions of the kidney we want to discuss, besides which we can see coming off, are renal artery, renal vein, and ureter. All of these come out a particular structure known as the hilus, or the hilum. When we open this up, this model, we will see all the structures coming out through the hilus. Now, so these are suprarenal veins and suprarenal arteries, in which we discussed previously, but we have our renal veins and renal arteries. Renal artery, renal vein, as they come out to go to the aorta and vena cava. We work our way out inside here, and the tan color material that you see, very soft in appearance, is the cortex. And we work our way deeper into the medulla, which is comprised primarily of these structures called the renal pyramids. Renal pyramids. And as we come to the bottom of the renal pyramids, you will look at the portions at the bottom, much like projections of the tongue, the renal papillae, the papilla. So let me zoom in just a little bit more on these models so we can kind of cut out a little bit of our suprarenal gland or adrenals to see the renal papillae on renal pyramids. Now they drain into two tubular structures. As they drain in, and a few of these show them pretty well, what we have coming down from here, we have what's called a minor calyx coming down, minor calyx coming in. And then they will unite to form what's called a major calyx, or a major branch, that will drain the formation of waste products into this area. So as we run in here to the major calyx that comes in, it will drain out this material into a tube that opens up later on that drains out through the ureter, called the renal pelvis. Now, we remind ourselves of most of the structures there. The major and minor calyx is the medulla, deep inside. In this model, you can generally get in here to see the renal sinus here, the space opposite of the ureter on the top of the hilus. And generally, that should be all the structures we can see on this particular model, besides the renal lobe that is comprised, everything from the inside out to the cortex, is a particular lobe of the kidney inside. And this model does a good job of depicting it. We'll discuss it from other models that are much larger, as we will discuss our large kidney model, one of our larger kidney models, and we have a few that are fairly good in size, and this one depicts everything rather well. Again, we remind ourselves the outside, the renal cortex, the renal capsule, inside the renal cortex. Now this model does an excellent job at depicting some of the blood vessels I want to discuss in the next section, is why I'm bringing this one up now. And again, renal pyramids, renal papillae on the end, minor to major calyx. We come in, renal pelvis will be in here, ureter. We see renal artery, renal vein. And then we hit some of the major structures we see here. You can see here in the green the nephrons, as we continue on into these blood vessels, which I want to discuss off of this model, because this one is the best for depicting that. Now we come in with the renal artery, and it branches off and becomes segmental artery. Segmental artery will branch off, continuing up inside to this particular system. And we can see another bit of segmental going up this way as it goes off to branch and form interlobular and interlobular arteries. between the renal lobes, as I depicted, where these structures continuing out, you have arteries passing between, called interlobular arteries. They continue on up here to form interlobular arteries. Now, interlobular arteries, as we depict here, will branch off into these particular portions as we discuss the arterioles here. Now, veins do continue up. We have our renal vein, which will form interlobular, as we go through the interlobar veins, and they will continue on along with both of these. We have two that comes the arcuate vein, arcuate arteries. So they will continue on over top at the base of the pyramids. So between and on these areas. And this one also does a great job of depicting a projection of the cortex going in, called the renal columns. And these veins and arteries pass over. These go around the top of the renal pyramids. The arcuate arteries, arcuate veins. And so the interlobar, and then interlobular. And you can see a little bit of interlobular vein here. And this one does a great job of depicting those particular structures. As we move on to the nephron, which is seen here in the center, the nephrons, it does show a pretty good job of our interlobular arteries going up, where they will form here in the afferent arterioles. Then we come here to see the individual nephrons that actually come into what we call renal corpuscles. And we have our nephrons as they continue up. Now, you will find in the nephrons the collecting ducts as they go down and branch off, collecting ducts going up to the individual nephrons that form an area inside there, form a structure called the glomerulus. And the glomerulus, and I will have to make some room to scoop this one over to look at the renal corpuscle that we refer to. The glomerulus is a dense pack of capillaries that come in, and we talked about the arterioles that were coming through there that come off the afferent arterioles. We have our afferent and efferent arterioles here, and they are close associated with this structure. This is the proximal end. This is the distal end. We have our proximal convoluted tubule, our distal convoluted tubule. On the distal end, you have the afferent and efferent arterioles coming in to form the glomerulus. And in this model, there will be an association between the structures that form the glomerulus and these cells that would form what we call the juxtaglomerular apparatus, or a complex. And so the juxtaglomerular apparatus. This one doesn't do a great job of showing that. The next model does do a really good job of depicting the juxtaglomerular apparatus, and that's where I'll begin on it as I work our way back, just to show you one of the other kidney models. Let me add it this way so we can see it. Let's get ourselves situated quickly that this is the proximal, this is the distal. So this is the distal convoluted tubule coming out the renal corpuscle in total. We have the Bowman's capsule here, and inside we have our afferent and efferent vessels, efferent arterioles are branching here. And we have this region here where we have our juxtaglomerular cells here. You have your macula densa cells here, and a close association with these two cells form what's called the juxtaglomerular apparatus. So juxtaglomerular cells, we have our macula densa cells, juxtaglomerular apparatus, afferent, efferent arterioles, distal convoluted tubule, proximal convoluted tubule with its cilia inside there. Now, one last thing I want to discuss is the large kidney one more time, because this one does an excellent job of showing some of the structures that I would love to discuss, and just make sure we can see them, because this one does a great job. Again, renal capsule, renal cortex going in renal columns between the individual pyramids, continuing out renal lobe, and these pour into the minor calexes. And here we have a minor calyx into major calyx, going to renal sinus, going out the ureter. Again, you will be able to see the renal artery, renal vein coming out to form the arteries as they branch back out are segmental arteries. Then we go into the interlobar arteries and veins, the arcuate arteries and veins, and the interlobular arteries and veins. And then these structures we're pointing at here represent the renal corpuscles. So we can see these pretty well. This is a great model for depicting most of those structures. We've already seen the nephron, and it doesn't do the best job of depicting the nephron. And the models we looked at does just a good enough job that we no longer need to look at it. And the last thing I want to discuss is some of the structures we can see in our very large stand of these guys. And again, we have our renal system, and we have here our two kidneys. And you want to note here is the aorta as it goes down, and here is the vena cava. Note that the renal arteries branch straight off, renal veins branch straight off, and this would actually be passing underneath. The kidney here on this side, we actually have to travel further with our renal artery than it does on the right. So on the left side, renal artery is longer than it is on the right side, but on the left side, the renal vein is shorter than it is on the right. We have this structure, the uter, as we depict coming off of this model, coming off the uterus down, and it continues on down to a structure called the urinary bladder. And urinary bladder is it contains smooth muscle and transitional epithelium. Down here we can see the prostate. Now, this model doesn't do the best job at depicting all the bladder itself, and for that I want to look at a different model. Let me pause real quick to get that model out of your torsos. So I'm looking at a model that does a little bit better job at depicting it. This is the one that most of you guys have been using. Again, remind ourselves the uterus coming down and emptying into the bladder. And as I open the bladder and remove the uterus and remove this structure, because I will talk about it later, you will see in the bladder a layer of a roughened texture called the rugae. And then we come into the trigone that will empty out the urethra. And we actually refer to this as the prostatic urethra, the prostate urethra, because of the association with the prostate. Now this is found just above this is on the side where the uterus come in, and you will find the openings or the orifice, the urethral orifice, or the uterine, or where the uterus come in. The orifices for the exit for the uterus here, as they've been painted on in a light orange color. And if I take the rest of it just to show you a depict one more time, the trigone here, the rugae, and the urethra as it passes through, barely visible on this model without doing some contorting. But you can see all of it from that other model, which does a really good job of depicting it for the urinary system. And all this in total, the trigone, the urethra, the opening for the uterus, and the rugae, the bladder. Now, one last structure we would discuss inside here in the upper region, you would find a layer of muscle called detrusor muscle that would be sitting in here. We have no model that accurately depicts the detrusor muscle, but that's where you would find it as a layer of muscle for the contraction of the bladder. And this should conclude my video discussing the urinary system. If you have any questions, please ask, and I hope this helps you in your studies as you go through to learn the structures of particular body systems in your AP2 labs. And this concludes my video.